Are you taking a fish oil but not sure if it's safe, effective, or even worth it? Well, stick around and I'll give you everything that you need to know about this very common supplement. Hey guys, Dr. Ashley here. I have so many patients that come to me who are on a fish oil supplement or that I start on a fish oil supplement because it is a great therapy for many different conditions. However, there's two big problems that I see with it. First of all, it can be very expensive. And if you're going to spend money on it, you want to make sure that you're taking it appropriately. And at least 90% of the patients that I see that come in already on a supplement are not getting enough of the right quality. So let's dive into everything that you need to know about it so that you can take it appropriately. First of all, what is fish oil? Fish oil falls under the category of MUFAs, or monounsaturated fatty acids. These fatty acids are considered essential, meaning that we cannot make them in our body and must get them through our diet, through our foods. These MUFAs are broken down into three categories: omega-3 fatty acids, which are fish oil, omega-6 fatty acids, which we'll talk about in a second, and omega-9 fatty acids. Omega-9 fatty acids are also very beneficial for your health and have a lot of good heart and anti-inflammatory properties. They can be found in the forms of olive and olive oil, avocado and avocado oil, nuts and seeds, and I recommend you eat plenty of those in your diet. Now let's talk about omega-3s and omega-6s. Both of these, again, are required in our body and we must consume them in our diet. But it's very important to look at the ratio of omega-3 to omega-6. Historically, as humans were evolving, we were getting a very high amount of omega-3 fatty acids and a lower amount of omega-6 fatty acids. As humans evolved and our diet has changed, this ratio has reversed and we're getting a lot of omega-6 fatty acids and much lower amounts of omega-3 fatty acids. Omega-6 fatty acids are very pro-inflammatory. Omega-3 fatty acids are very anti-inflammatory. Again, the goal is not to get no omega-6 fatty acids and only omega-3 fatty acids. We just want the ratio to improve from higher amounts of omega-6s to higher amounts of omega-3s. And you can do that by reducing your omega-6 intake and increasing your omega-3 intake. Omega-6 fatty acids are found in vegetable oils, eggs, some poultry, as well as in nuts and seeds. I recommend just cutting out the vegetable oil in the form of processed foods, and that will usually lower your omega-6 intake adequately, in addition to ensuring that you are getting enough omega-3s. So let's talk about those omega-3 fatty acids. They can be broken down into three different forms as well: ALA, EPA, and DHA. EPA can be thought of as more functional. It helps the actual physiological processes in our bodies work, especially those anti-inflammatory processes. DHA can be thought of as more structural. It goes in and actually helps form the various parts of certain cells in our body. However, DHA also serves a very functional role when it comes to brain health. And that's important when we talk about which conditions you are using these supplements for, because that will change the ratio of these products that you want to get. So stick with me and I'll walk you through that a little bit more. And then finally, ALA. ALA is the more plant form of omega-3 fatty acids, and it can be found in substances like walnuts and flaxseed. It, again, is a good source of omega-3 fatty acids. Unfortunately, our bodies don't do a great job of converting it to those more useful forms of EPA and DHA. We are only capable of converting about 10 to 15% of ALA to EPA and DHA. So that's why, if you are able to and willing, I recommend fish as your primary source for the omega-3s, because you're going to get a bigger bang for your buck. But we'll talk about alternate options if you would like to avoid fish. One option is instead of using a supplement, you can try to consume enough omega-3 fatty acids in the form of EPA and DHA through your food. And that, again, is primarily going to come through fish sources. One easy acronym to remember is SMASH fish. They are going to be the highest in those healthy omega-3s that you're looking for. And SMASH stands for salmon, mackerel, anchovies, sardines, and herring. The goal is to eat at least 3 servings of one of those fish per week in order to get enough of those omega-3 fatty acids, which can be difficult just depending on where you live. If you live near the ocean, maybe a little bit easier versus in the middle of the country, like me living in Colorado. Other food sources of omega-3 fatty acids include oyster, mussels, trout, and some forms of tuna. Of course, you may also be worried about the mercury content of these foods. Most of these foods tend to be not top of the food chain. It is those fish that are on the very top of the food chain that consume all of the other things below them in the food chain that are highest risk of higher mercury concentrations. You're thinking shark, swordfish, things like that. However, the EPA website is a great resource to let you know which brands to purchase in order to minimize your mercury load. So who should take a fish oil supplement or try to ensure that they're getting a high enough amount through their diet? The conditions that have some excellent evidence for the use of fish oil in them include high triglycerides, which is one component of the cholesterol breakdown, heart disease, depression, painful periods or menstrual pain, rheumatoid arthritis, ADHD and ADD, asthma, anxiety, and seasonal allergies. Additionally, there is some good evidence for the use of fish oil in several other conditions. That includes osteoarthritis, which is different from rheumatoid arthritis. Osteoarthritis is your general wear and tear of the bones without an autoimmune or inflammatory component. Hypertension or elevated blood pressure. Bipolar disorder, specifically the depressive component of bipolar disorder. Dandruff, low back pain, and chronic pain in general. Additionally, less evidence for these conditions in the literature, but I use them frequently for my patients that I see, includes fibromyalgia, eczema, and the prevention of cognitive decline with aging. Okay, now let's talk about the actual dosing of it. Whenever you're going to pick out a supplement, whether it be online or at the store, I want you to turn around the label and actually read the product breakdown so that you can ensure that you're getting enough of the appropriate amount of omega-3 fatty acids. The 2 things that you need to look at are, first, that most of the fatty acids are coming from EPA and DHA. Remember, those are the most functional components that our body can actually utilize. If you're targeting inflammation, such as in the case of any inflammatory condition like rheumatoid arthritis, allergies, or eczema, or anything like that, you want to try to get a higher percentage of EPA. And this is versus if you are targeting more of those structural things, especially brain issues. So if you're targeting cognitive decline prevention, depression, bipolar disorder, heart disease, things like that, then you want to get a little bit higher of a concentration of DHA if possible. Again, we're not talking about exclusively DHA versus exclusively EPA. Somewhere in the realm of 40 to 60% of each would be very helpful. Next, you want to look at how many milligrams of each of those are there per serving. And it's very important to look at the serving size. Is it 1 capsule or 2 capsules or more? And remember that 1,000 milligrams is equal to 1 gram. So when I tell you about the specific conditions, I'll try to give you the conversion for both, just so that you're aware of how much you're shooting for depending on the specific condition that you're trying to take the supplement for. So if you are taking a fish oil supplement just for general health and prevention, the goal dose of EPA plus DHA is around 1,000 to 1,500 milligrams. or 1 gram to 1.5 grams. If you're targeting heart disease, high blood pressure, things like that, you need to be getting at least a minimum of 2,000 milligrams of EPA plus DHA daily. That's 2 grams. So you're shooting for somewhere between 2 to 3 grams or 2,000 milligrams to 3,000 milligrams. If you are taking a fish oil supplement to target high levels of inflammation, in the case of really bad seasonal allergies or rheumatoid arthritis, something like that, usually you have to do a higher loading dose followed by a lower maintenance dose. And that looks somewhere in the realm of 4,000 milligrams to 5,000 milligrams, or 4 to 5 grams of EPA plus DHA daily for 6 to 12 weeks. Then you can drop it down to that maintenance dose. For rheumatoid arthritis, the maintenance dose would be closer to 3 grams or 3,000 milligrams per day. For allergies, it can be a little bit lower, somewhere in the realm of 2,000 milligrams or 2 grams per day. And finally, if you are using this for depression, anxiety, ADHD, cognitive decline, anything like that, you're shooting for that 2,000 milligrams to 3,000 milligrams or 2 to 3 grams per day. And again, you want to try to target a higher dose of DHA over EPA. The last thing that I wanted to point out about dosing is that you need to check based on what condition you're using it for and what dosage per capsule you're getting to ensure that you are not having to take 10 tablets of fish oil a day. Because some of those lower quality supplements will be cheaper, but in order to achieve the high enough amount of those necessary fatty acids, you may be having to take 8, 10, 12 plus capsules of fish oil per day. So in that case, it might even out that paying a little bit more for a higher quality supplement is actually a wash, or actually saves you a little bit of money because you have to take a lower volume in order to get the appropriate dosing. So finally, let's just talk about some concerns or precautions to use if you are going to start a fish oil supplement or you're already taking it without supervision from a physician. The first that you've probably heard of is concerns for easy bruising or bleeding. Overall, this is very low risk. If you're taking that really high loading dose for allergies or rheumatoid arthritis, you probably will notice that you're having a lot easier bruisability. But at these more common, anywhere from 1,000 to 3,000 milligram daily dosing, usually very low risk. You're going to be at higher risk for this if you are taking a blood thinner. So if you are on Plavix or Warfarin or Eliquis or aspirin, anything like that, you're going to be at a little bit higher risk. Not at a high enough level that you would be at risk of bleeding out from a cut or something like that. You just might notice that, oh yeah, I have a ton of more bruising on my arms, or it takes a little bit longer for my blood to clot after I do get a cut. One thing to do is to stop the fish oil supplement 7 to 14 days prior to any surgeries, just to minimize that risk of any of those procedures. Another common side effect that people often complain of is fish burps or acid reflux that tastes like fish, which is gross. I get that. One way you can get around that is if you are using the capsules, you can freeze them. So you just take them straight out of the freezer. They stay frozen until they get past your stomach so that you don't get that reflux and that fish taste in your mouth, that fish smell. Another great way to get around this is that some products are made in liquid form with other flavors like lemon. And actually, I have tried them and they taste very good. They don't taste fishy at all. So if freezing them doesn't work or you can't remember to pull your supplement out of the freezer, just try a liquid formulation instead. Finally, what if you are vegetarian or wish to avoid fish for some other reason? The alternate option would be to consume flaxseed on a daily basis. You will need to consume at least 2 tablespoons of flaxseed per day in order to get roughly 2 grams or 2,000 milligrams of a fish oil supplement. Flaxseed is very high risk for going rancid quickly. So I recommend buying flaxseed whole and then grinding it just prior to use, or using it in its whole form as much as possible. All right, as I mentioned, fish oil is one of the most common supplements that I see many of my patients on, and I start many of my patients on because it has such great benefits. Are there other supplements that you take or have heard of, considered taking, that you want to learn a little bit more about just to make sure that they're safe? If so, please leave a comment. That way I can hopefully deliver such a video to you in the future. Also, make sure to subscribe to my channels so that you don't miss any future videos that might be helpful for you. Fish oil is great for combating inflammation. Another source of high inflammation besides those omega-6 fatty acids is insulin resistance. And that can cause a slew of symptoms, from difficulty losing weight, excessive accumulation of weight around your midsection, that kind of spare tire look, lots of fatigue throughout the day, and just feeling like the rest of your hormone system is not working. If you're worried that you're suffering from insulin resistance, make sure to check out my new ebook, The Insulin Reset. You can head over to my website at selfhealingdrashley.com. All right, we will see you next week.